I've been teaching not only pharmacy law and ethics, but health information technology like electronic medical records for our certificate program. And our sister school at KGI is, it's called the Applied Life Sciences. And that school is for master's and PhD students going into industry. And I think it's really important to understand all of the ethical opportunities that are in the pharmaceutical business, for example, where ethics really come into play, being very important. And so I teach a bioethics class on that side. It's very different than what I teach the pharmacy students as far as ethics, because that's a little bit more self-contained. So let's talk about some of the traditional roles that I'm sure you all know about. Community pharmacy practice. Well, you just have to go and visit my friend down at CVS in Target, just a short ways away. Have any of you ever gone to talk to him by any chance? Nate? Okay, his name is Nate Slater. He's a PIC, pharmacist in charge, and he's a great guy. So if you do want to talk with him about community pharmacy, you've got somebody that's a local reference just down the street. But anyway, so what do community pharmacies do? Well, immunizations. I'm sure you've all had vaccines from given by a pharmacist. Teaching smoking cessation, self-administered contraceptives. Now, this is a relatively recent event, and we've been working basically with the Board of Pharmacy, with the medical board, to develop a protocol so pharmacists can now basically furnish oral contraceptives and other hormonal self-administered drugs. And something brand new, you might have heard about it in the news, the law just passed last year, but pharmacists will be able to furnish both post and pre prophylaxis for HIV, which again opens up another resource for the community that they don't have to go to a physician and get a prescription. They can now come into a pharmacy and pharmacists will counsel the patient on the use of the drugs, use of the disease, and so forth. And then there are some outpatient services. These tend to be in hospital systems that have ambulatory care clinics, but drug monitoring, chronic diseases such as hypertension, diabetes, and one that's very, very popular and common is what's called an anticoagulation clinic, because some of the drugs that are used have a very narrow therapeutic index. In other words, the difference between being toxic and useful is a very, very small percentage. So hospital pharmacy practice, in kind of my roots, specialty practices abound. You can imagine in hospitals they have different nursing units that focus on different disease states. So critical care, which was my area. As it turns out, we opened a neonatal ICU at one of the hospitals that I worked at. So I became the expert in neonatal drugs, which is more like veterinary medicine than human medicine, at least it was up to that point for me. And then general medicine, emergency room pharmacist. That's actually a fairly new development that hospitals are finding. It is cost effective to staff their ER with a pharmacist. And again, I think that's really been a good progression in terms of the profession. Consulting, there's another area. Skilled nursing facilities. These are areas that aren't quite acute care. They're more transitional between the hospital and the community. But those don't necessarily have a pharmacy in them, but there's a pharmacist that needs to come in and actually review the medications of every patient and also ensure that the drug distribution system is safe. And then there are rural hospitals that are called critical access hospitals, typically less than 100 beds, not required to employ a pharmacist, but the pharmacist needs to be available to consult. And then there's industry, pharmaceutical sales. Again, the new drug comes out by a brand new manufacturer. They want to market that drug, besides advertising it to the lay public on TV, as you I'm sure have seen those ads. but actually working with physicians, encouraging them to use the drug. Medical liaison, which is a little bit different focus. That is really focused on the science and educating the clinicians in terms of the use of that particular drug. And then there's one step back from that. What about actually when drugs are in development and they're going through human clinical trials? The pharmacist is very valuable in those contexts too. So those are some of the areas I think that I call traditional pharmacy practice. And then in all of these areas that I just talked about, management is another area. So if you are interested in the management side of things, opportunities abound there. A few other traditional roles, nuclear pharmacist. And I say it's the pharmacist's job 90% of pharmacists haven't even heard of. It's a very, very specialized area, as you might imagine, working with radioactive substances that are used in imaging and therapy for patients. And it was actually the first specialty that was actually recognized by the Board of Pharmacy Specialties. For those of you interested in working in Orange is the new black, there's correctional facilities. And obviously you're dealing with very high-risk populations there, HIV, hepatitis, and sexually transmitted diseases. And so the need for medications and managing that is also an area where pharmacists can find a role. Academia, pharmacy schools, pharmacy technician schools, because we do want our technicians that are coming out to assist us to be knowledgeable about the system. And medical schools and nursing schools. I know a couple of pharmacists that actually are on the faculty of schools of medicine because pharmacology is an area that physicians don't get a lot of exposure to. And so that's really a big knowledge gap. All right, so how about some non-traditional roles? Well, and I put advanced practice pharmacist here as non-traditional only from the context of the types of things that an advanced practice pharmacist can do. They can actually set up a practice outside of a licensed pharmacy and do the medication management from basically wherever their office is. They can order and interpret laboratory data and so forth. And they can also refer patients when they have see a problem that they can't handle. They can refer patients to other practitioners, which a regular pharmacy license does not allow you to do. Education, teaching patients, teaching other clinicians, and teaching the general public. The general public is pretty lacking in knowledge in terms of what pharmacists do because all they see is CVS, right? Unfortunately. And medical writing, if you're a writer and you like to write, that's another area that is a very, very ripe role for you. And then I apologize for the size next year, but pharmacy benefit managers, which are middlemen between insurance companies and pharmacies that are dispensing medications. That's another area where a pharmacist is definitely needed to make a decision on what drugs are going to be used and so forth. Specialized consulting, again, optimizing medical use processes, being an expert witness, which none of you would be able to do initially out of school, of course, but as you develop experience, and especially in a particular area, that's a potential role for you. And then working with reimbursement from insurers, that's a huge area. And then we move into some of the political things, the regulator, Board of Pharmacy, being a member of the Board of Pharmacy, or being an inspector for the Board of Pharmacy. Legislator, one of my friends, Jeff Stein, was a California state senator until he moved on to the Trump administration. But he was a pharmacist, and he actually generated a lot of really valuable laws for pharmacy that we needed an advocate in the legislature. And then Buddy Carter is in the U.S. Congress, again, just as an example. Advocating and lobbying for the pharmacy profession, working in CSHP, California Society of Health System Pharmacists, or the California Pharmacists Association. That's another area that is really valuable. And basically touch base with a lot of different personalities. Informatics, very briefly, I know I'm running out of time. Hospital systems such as electronic medical records, automation that are used for drug distribution, outpatient pharmacy systems, again, electronic health records, and pharmacy information system vendors. So you might want to work actually for the company that is developing new features for their electronic medical record. And that's actually a very interesting plan. And then I'd like to point out my friend Scott Joslin. He was CIO for Memorial Care, Chief Information Officer. And obviously that's a very highly paid position. How about NASA? Anybody think that a pharmacist has anything to do with NASA? There's actually a NASA pharmacist. So she's basically looking at what medications should be used when somebody that's up in the International Space Station has a problem, right? Then there's people like me, pharmacist attorneys, and we can defend pharmacists. I like to instead be an educator, do laws, and advocate for the profession. And then there are all these other hybrids where you can take the PharmD and use that to become a PA, an EMT, even a physician. So it's a small percentage of students that will end up doing those things, but again, it's another opportunity. So my conclusion is, traditional roles are always going to be out there, but your degree can do so much more. And I want you to think beyond what you have probably envisioned pharmacy to be. The world's what you make of it, and again, follow your passion, and you will find your passions will develop over time as you start to learn all the different parts of education in the pharmacy school.